My name is Dr. Christopher Sendy. I'm with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia, and I'm going to discuss the treatment of depression and other mood disorders with ketamine therapies and the intake process, the process from front to end for receiving ketamine therapy. So, are you considering ketamine? So, if you've been suffering from low mood or anhedonia, which is no mood at all, meaning you just feel like you just exist, you don't feel excited about the next great adventure, you're not hopeful, you don't feel happy, but you're not necessarily sad. Or if you're having side effects from your traditional antidepressants, um, that would be something to consider that maybe ketamine therapies may offer an option. How about brain fog? Have you been having trouble with your verbal memory, remembering, for example, who the actor was in a specific movie or the name of a particular item in front of you? Or have you been having trouble just kind of processing information or remembering phone numbers? Now, we live in an age of cognitive capital, meaning that most of our jobs require a lot of mental energy to get them done. And we notice whenever we lose a few IQ points that we're having trouble getting our jobs done and focusing and concentrating. And so, individuals who are depressed frequently have brain fog. And how about low energy or low motivation? Or do you feel so depressed that you can't even get out of bed? You can't do self care, such as brushing your teeth or taking a shower or combing your hair. People will look at you like you're lazy or something, but the reality is that your brain is actually operating at a different level of its neurocircuitry due to depression. Are you tearful, crying, or sad all the time? Or do you have just constant low self esteem? Are you self sabotaging yourself with negative self talk, guilty feelings, anxiety? That's the negative side of your brain that's just in overdrive during depression. How about, have you lost a lot of things because of your depression? You just can't get moving, you can't think, you're making bad decisions, your executive functioning is off. Have you lost your job because you just can't get there in time or do your job when you show up? Or have you lost family? Have you gotten divorced because of irritability and agitation and just difficulty with social constructs? Or how about money? Just difficulty with managing your finances. So if you have no joy, no hope, even suicidal thoughts, or how about just a failure of talk therapy and multiple medications, and you've gone through the hamster wheel of medication after medication? Do you feel like you just haven't achieved what you should have at your age, and just a loss of fulfillment? Or irritability, agitation, insomnia, poor decision making? These all may be symptoms of just low neuroplasticity and a glutamate problem. That's a molecule that you've never heard of. Everybody talks about serotonin and dopamine, and that's the molecules that we generally are looking to treat with the traditional antidepressants. Serotonin, known as the molecule of happiness, and dopamine, the molecule of motivation and reward. But really, traditional medications don't affect the glutamate system, and the glutamate system is the primary system in our brain. Glutamate is the molecule of learning. It's a neurotransmitter of learning, and it represents 60% of our cerebral cortex neurotransmitter load. And none of the antidepressants that you are using currently affect that particular system. And that is the system that sculpts the tone of serotonin and dopamine. So a lot of the traditional antidepressants are treating basically a symptom of a problem as opposed to the core root problem, which is glutamate. Any mammal has glutamate in their brain, and glutamate is the key neurotransmitter, and that's what ketamine affects. So if talk therapy and these medications didn't work well, why don't you consider a new language for your brain, the language of ketamine? So, what is the process to get treatment with ketamine? The first question is, are you a candidate? Well, exactly what condition are you trying to get treated for? And is it diagnosed correctly? Have you been treated with the right medications at the right dose and the right length of time? Have you even been compliant? One of the things I find is that a lot of patients have the medications just sitting in their bathroom cupboard and just they're not even taking the medication. So if it's not being used, then obviously it's not going to work. And have you incorporated lifestyle changes? Have you tried things such as psychotherapy, cognitive behavioral therapy, dialectical behavior therapy, EMDR, other types of treatments? And how about TMS or ECT? And of course, there are other types of traditional medications available as well. So all those things should be accounted for, and you should do your due diligence in looking at them. Now, ketamine effectively treats severe depression, treatment-resistant depression, postpartum depression, obsessive compulsive disorder, post-traumatic stress disorder, anxiety disorders, bipolar depression, some addiction disorders, suicidality, and neuropathic pain such as CRPS and headache disorders. And of course, those are different protocols, and we'll discuss those at a later time. Now, there must be side effects of your prior treatments. I mean, you've probably had ineffective treatments before, multiple ones, I imagine. And other antidepressants, they focus on the monoamine system, which is serotonin and dopamine, not the glutamate system as ketamine does. And serotonin and dopamine, we all know those molecules. Serotonin is the molecule of happiness, and dopamine, the molecule of motivation, reward. And those are ancient molecules. They're lizard brain molecules and midbrain, deep brain structures. Lizards have serotonin and dopamine. That's why they focus on immediate rewards, whatever is going to get them something right now. And serotonin is what makes locusts swarm together. That's how ancient serotonin is. And so a lot of the treatments we currently use focus on those neurotransmitters and altering them. And yes, they're important, but again, their tone is sculpted by glutamate. And when you look at traditional treatments, about a third of antidepressant treatments are effective in terms of treating depression, but relapse occurs about 50% of the time within a year. And a third of patients with depression are treatment resistant, having failed 2 or more medications. And then you have other side effects of your traditional medications, your antidepressants, such as weight gain, sexual side effects, hair loss, anhedonia, which is a big one. It's a side effect. It's actually kind of a part of the experience of depression, which is where you just don't feel anything. You're just in a state of numbness. You're not excited. You're just not sad. You just kind of exist, and you just go from day to day, just not feeling hopeful. And how about like allergic reactions? Now, certainly there are medications like Lamictal, which can have severe allergic reactions and other side effects. Now, ketamine rarely has allergies to it, and there's rare drug interactions. It is felt that benzodiazepines like Valium and Xanax can make ketamine a little bit less effective, as can potentially Lamictal, but clinically, we haven't seen that to be too significant. Usually higher doses of ketamine work well in these individuals with anxious depression. And how about non-compliance? You've been non-compliant as a side effect of your prior treatments because you just can't stand the way they make you feel. And sometimes you take them and you're compliant and they just quit working, which goes to show that depression is neurodegenerative and it's progressive when poorly treated. And that's been shown because you could see areas of the brain that actually shrink with depression, the prefrontal cortex areas, hippocampus, and a number of other significant areas have been shown to have on MRI smaller volumes in patients who are depressed. So it goes to show again the neurodegenerative and progressive nature of depression. It's an emergency and it needs to be treated now. How about lifestyle issues? Are you in a toxic home environment where there's physical abuse, emotional abuse, sexual abuse? Did you have a bad childhood, especially that first 25 years of life where your brain is developing from back to front? Did you have these same situations where you had abusive situations, lack of love, lack of structure? And of course, that sets your emotional tone for the rest of your life, and it turns on the genetics of depression as well if you have those genetics. Add into that things like substance use, drug and alcohol abuse. And how about other things such as lack of exercise or a difficult work environment, financial stress, shift work, which causes basically problems with your sleep-wake cycle, insomnia, and of course obesity. Obesity increases the risk of depression by 4-fold, and it also decreases the efficacy of your antidepressants. So if you're overweight, your medications are not going to work as well. And it's not because you're not taking enough of the medications, it's just the way that they're processed in your body. And then there's things like unstructured time in an unenriched environment. So if you're not challenged, you're not going to change. And if you have unstructured time, then your brain starts to wander into the future and the past, which generally are anxiety provoking. And historically, there wasn't a whole lot of unstructured time. We were generally busy just surviving day to day. And of course, excessive marijuana, which is initially helpful, but over time, if you don't take it, then you begin to see withdrawal symptoms, which can be quite significant. And marijuana does interact with other medications, as it does affect the CYP3A4 system. Now, the question about whether you can receive ketamine immediately has to do a lot of times with just medical problems. Some people need medical clearance, such as if you have COPD or chronic obstructive pulmonary disease from smoking or severe sleep apnea that's not treated, cardiovascular disease like heart attacks, peripheral vascular disease, and stroke, uncontrolled hypertension, diabetes, liver and kidney failure, schizophrenia, pregnancy, active substance abuse as well. Those types of situations, require some sort of medical clearance or deep evaluation, and that's what we do on the initial intake with the medical and mental health intake at Nova Health Recovery. We also look at your support structure at home. I mean, are you having continued trauma when you go home? Are you getting slapped in the face still? Are you being abused? Are you being completely ignored? In those situations, obviously, the infusions of ketamine are not going to work as well. You need to have a supportive, loving environment at your safe zone, which would generally be your home. And of course, if you're actively suicidal in an unsafe environment and impulsive, then you would probably need to go to the hospital for initial stabilization. Now, just to let you know, ketamine therapy will not improve or change personality disorders. So that's also a key thing. I cannot change your preferences. Consider lab testing. It's not always necessary, but lab testing is important for some people, especially as they get older. And sometimes when individuals haven't had a workup in a long period of time, it's important to check things like blood counts, white count, hemoglobin, liver function tests, kidney function, pregnancy tests and drug testing, lithium levels if you're on that medication, and thyroid testing, with the complete testing, TSH, T3, T4. A lot of times, your endocrinologist will just order a TSH, but the reality is that you can have abnormalities that are getting worse and you only get a snapshot in time. And these other subtests are very important in determining the possibility that you have a sick thyroid, which can affect your mental health, because the thyroid itself and a lot of the areas that it impacts affect mental health. In fact, sometimes we'll use Cytomel to help augment the antidepressants you're typically on. And then there's Lyme disease workup and tick-borne illnesses. That can certainly cause a lot of significant pain and mental illness, cortisol levels, whether high or low, and then diabetes testing and insulin levels. So it is known that in patients who have mood disorders and mental health, that they have a significantly higher risk of heart disease, stroke, and diabetes because there's a bidirectional flow of basically medical problems and mental health problems. And so measuring hemoglobin A1C and insulin levels can be important in kind of dissecting that out and considering treatment for that. People actually with depression will have a shorter lifespan simply because of the consequences of the metabolic complications of insulin signaling that are affected by mood disorders. And of course, there's elevated insulin cortisol levels as well, that HPA axis that can get activated in stressful situations. What about vitamin levels? B12, zinc, magnesium, vitamin D, and the omega fatty acid profiles. All those can be helpful, especially if you have a history of alcoholism or an unusual diet or restrictive diet. And then we look at integrative labs sometimes, mold toxicity. There's a lot of molds in older houses that can affect individuals. There is something called inhalational Alzheimer's disease, as well as organic acid testing to detect all sorts of gut-borne illnesses, and SIBO testing, which is small bowel overgrowth, which can basically cause organic acid changes. So small bowel overgrowth with things like, for example, Candida or Clostridium, they can produce substances and alcohols, certain types of alcohols that can cross over into your bloodstream and cause the breakdown of neural networks in your brain, including the formation of something called quinolinic acid, which is neurotoxic and can increase your risk of depression. And we should think of food allergy panels, celiac disease, heavy metal exposure, especially if you're soldering, for example, or in certain types of work, and inflammation workups with CRP and SED rates and IL-6 levels. And also, there's hereditary disorders like Wilson's disease, which can be associated with neuropsychiatric syndromes at younger ages. Now, considerations for rheumatological workups for vasculitis and autoimmune encephalitis, PANDAS, which is an autoimmune encephalopathy due to strep infections. And that can be seen in young people when they suddenly get obsessive compulsive disorders and unusual behaviors after a strep infection. And you should consider immunological workups for some individuals just to see if they're at risk for increased infections and inflammation. And that can lead to, of course, mood disorders and depression. Inflammation in their peripheral body, especially if you're overweight, have infection, or other autoimmune disorders, can actually transmit to the brain, and the brain can get neuroinflammation, which increases depression. Neuroinflammation increases inflammatory mediators that will break down networks in your brain, as well as decreasing synaptic connections, and neuroplasticity decreases. Also, sleep apnea workup. If you don't recognize that you're losing sleep, you could be tired all day long, and that, of course, also leads to inflammation in the brain. And a dietary assessment. So if you have restricted eating, some sort of eating disorder, anorexia, binge eating, or inflammatory diets, all of those, can lead to basically vitamin level deficiencies as well as mood disorders. So you are what you eat and you think about what you eat. So what is your knowledge of ketamine therapies and the alternatives? So you really should research your thoughts about ketamine therapy and do your due diligence. There's a lot of stuff out there. A lot of the YouTube channels discuss and show just people getting ketamine infusions, but there's a lot more to it than that experience. So you need to really look and dig deep. And ketamine, like other medications, is a treatment. It's not a cure, but the goal is to get rapid improvement within days and even get remission. And that remission is critical because it helps you maintain your basic cognitive abilities and mood much longer than just using a traditional therapy. And of course, you have to recognize that there will be required follow-up therapies, that depression is neurodegenerative. It's waxing and waning. So if you've had one episode of depression in your lifetime, you have a 50% chance of having a second episode. And after you've had that second or third episode, you're going to have another episode with greater than 90% chance. And they get more and more severe as you get older, especially with bipolar depression. Now, ketamine microdosing can certainly be helpful in the maintenance of effect in between booster ketamine infusions. Just to let you know, we'll discuss that briefly later. Now, during ketamine infusions, should you take your current medications? Do you need to change anything? And the answer is maintain your current medications. We want to just alter one variable, and that's the ketamine infusion. Traditional medications do serve a purpose, and they can be valuable in maintaining remission, or sometimes, changing those medications can be very helpful. But usually we do the infusions first and start changing medications later, usually in consultation with your psychiatrist. That's always the best way to work. Basically, the other issue that we have is that maybe your diagnosis is wrong and that it's not just treatment-resistant depression, but bipolar depression, because traditional antidepressants don't work very well for that particular diagnosis. And these patients with bipolar depression generally are irritable and agitated, brain fog, maybe insomnia during their hypomanic phases. And they just never really get great results with the regular treatments. And so it's kind of important to recognize that, if you're on a traditional antidepressant, you're just not feeling better, or if it even makes you feel worse, that bipolar depression may be a consideration. Now, using atypical antipsychotics, which is frequently used in bipolar depression, can certainly be an add-on medication for treatment-resistant depression. And We find certain medications work extremely well with ketamine therapies, and they're in the traditional realm. Now, if your goal is to be off all medications, you should really look at that twice and look at what's realistic. Again, if you've had multiple episodes of depression and we can get you feeling great with the ketamine infusions, then you probably just want to leave things alone, unless there's a lot of side effects of your current medications. Now, consider the problem that depression is progressive and neurodegenerative. It continues to get worse and worse if you don't appropriately treat it. There's actually cognitive scarring and metabolic complications that lead to early death from heart attack and strokes in poorly treated mood disorders. We know there's changes in sirtuins and insulin cycling, and we see that especially on new onset bipolar patients, especially, and basically patients with bipolar depression have a rapid increased risk of death at an early age because of metabolic complications like heart disease and diabetes. You should also continue your psychotherapy, even if you feel like it hasn't been helpful. The fact is that cognitive rigidity, which is your inability to think outside the box and consider new learning, is something that affects your ability to have psychotherapy work well. And ketamine helps decrease that cognitive rigidity to allow effective psychotherapy. So basically, the whole goal here is to kind of eliminate that shell of beliefs that you begin to develop that form over time when you're depressed. You begin to think a certain way, about certain things about depression and the way you feel and the way you think about yourself, and you encapsulate that. And it's very difficult to change those beliefs because it's easier just to keep those beliefs than it is to change them. And that's one of the things that we see as people get more depressed is they tend to get more fixed in the way they think. Ketamine and psychedelics can basically decrease cognitive rigidity and allow for more effective talk therapy. Now look at also other possibilities for treatment, including TMS, transcranial magnet stimulation, and ECT. They each have their advantages and disadvantages. Now just remember, ketamine therapy will not change your personality. It won't change your kids. It won't make you like your job. It won't make you like the color red when you like green. Basically, ketamine therapy, will help increase your mood and your ability to focus and have motivation. But the inner healing is really up to you. It's up to you to kind of take the next steps and take this treatment up to the next level. Ketamine allows all this to happen. And also remember, be realistic. 30% of patients, even more, might not respond to this treatment. Now, what is your role, the patient's role in ketamine therapies? Well, it's important for you to journal during the ketamine experience and keep track of what you're feeling and how you're feeling and why you're feeling it and what you're going to do about it. And this can be helpful for you to look back, especially immediately after your experience, because sometimes you find things that really make you think twice about the way you were thinking before, and that can help you change your mind. Now, at Nova Health Recovery, we use a mood app to help track your home moods, depression, anxiety, PTSD, based on medically validated indicators. But you have to enter that data. If you don't enter the data, we can't really address it then, and we can't change treatments. And that's one of the hardest things to do, is for people to recognize the importance of what they do today affects things later on. And that's called delayed discounting. And delayed discounting is damage in depression and mood disorders because of the way that the neural circuitry runs. So that said, it's also important for the individual to get moving, to actually get outside and get behaviorally activated. You have to structure your time so you have a schedule from beginning till end. So people who, for example, get depressed and say, I'm going to take some time off work to take care of myself, generally get worse because they have unstructured time. And with that free time, all they think about is how depressed they are. And they don't move unless they set themselves a regular schedule. And you also have to make certain that you eat well and you have lots of self-care and you focus on these things. And of course, socialization is important, whether it's at work or through intramural sports or meetups or just getting out. You want to avoid isolation. You want to avoid also bad processed foods. You want to aim for a Mediterranean diet, for example. Also getting out into the sun, very helpful for increasing vitamin D and melatonin, which is, of course, developed from tryptophan and serotonin, which then becomes melatonin. So there's a lot of cycling between those three very important mediators. in terms of mood and sleep. And also appropriate supplements go a long way, as through exercise and intermittent fasting and saunas, which produces increased heat shock proteins and also neurotrophic factors. Meditation and yoga, very helpful recovery tools. Staying compliant with your therapy and your medications. Avoid drugs, alcohol, especially marijuana. I hate to say that. Although you feel like it helps you, the reality is that the very substance you're leaning on frequently is making things worse. And it's not really a neuroplastic medication. It doesn't treat the underlying problem. It just kind of suppresses the emotions, and it makes you avoid creating new skills and a new toolbox to deal with problems at hand. The other thing is, when you're going through the ketamine process, avoid social media. That's stressful, and it's very difficult for us to kind of understand, all the things that are going on in social media and how it affects us. But it does, much like many other addictions, it does create stress, and that also goes to say you want to avoid stressful situations. Don't overschedule yourself at work or with your kids or your family. You need to set your boundaries, and boundary setting is very important when it comes to mood disorders and depression. So, prior to an infusion, declutter your mind, clear your schedule, set your treatment goals, make them achievable and very simple, and allow yourself time to reprocess your infusion experience afterwards. So, what if this treatment doesn't work? Well, ketamine can produce remission and or significant response in 60 to 70% of patients who have been treatment resistant and have failed everything else. And it's an amazing therapy, but there are some people that it doesn't work well in. Now, many will notice that the improvements may start at the fourth infusion. And of course, online they'll see, individuals who've had this aha moment immediately after that first infusion and say that they were cured. And you'll see this in a lot of movies as well, and a lot of shows on psilocybin, etc., that one dose cured patients, and that's not the case for any of these. No matter what the source is, most of the time people need multiple infusions, and by the fourth infusion, a lot of times people will start to see some results, but sometimes sooner, and sometimes it's very subtle, and things just get better and better. Now, for some, they just can't see that improvement. They have basically hot cognitive deficits and are unable to assess any improvement, even if the family can see that difference or others around them. Now, hot cognition is kind of an emotional cognition, and individuals with this disorder are more common. It was, as we mentioned in other videos, cognitive deficits are common in depression. And our ability to see ourselves for what's going on, interoception, is damaged. And in particular, patients who are depressed will more likely look to the negative side of things. They'll look at the side effects, that if there's a 1 in a million chance of something happening, they'll be more than willing to say, I'm not going to take it because it'll happen to me. And if they do get better, a lot of times they'll say, well, I don't feel better. And again, it's a lot of fixed thinking that goes on. So a lot of times patients don't notice how well they're feeling until they stop the treatment. And then they suddenly look back and say, oh my gosh, I was feeling so much better. And it takes time to be introduced to a new emotional tone, because sometimes it's not like a light bulb. You don't just suddenly feel better. You just improve sequentially. And so, relatively speaking, it's hard to say whether you've improved from day one to day seven. And it takes a little bit of time for that to happen. And for some people, they've been sick so long that it can take many months to really get that improvement that you want. So we utilize medically validated mental health scoring systems basically to quantify the improvement for this specific reason. And the domains that are affected could be many. It could be cognitive abilities, or it could be their ability to focus at work and concentrating, or self-care, a number of just quality of life indicators that really can be variable from person to person. And just again to remind you that some patients may need more than 6 infusions in that 2 to 3 week period, and sometimes at even higher doses for this to work. And there are certain single nucleotide polymorphisms, certain genetic aberrations that can interfere with ketamine's ability to work at lower levels. And like I mentioned early on, that some will see continued improvement over time. They just slowly get better. But likewise, underlying medication adjustments can sometimes be very useful, especially if your mental health diagnosis is wrong. And one of the big things we see is the individual has bipolar depression and not just regular depression. And bipolar depression requires a certain set of medications and treatments that are different than traditional depression. Now, also look at things like sleep apnea, which also can interfere with medications, and so can obesity. If you're overweight, it is more likely that your medications are not going to work, and obviously weight loss will be helpful. Now, weight loss um, certainly seems like it would be the effective method to improve, but the fact is that individuals will say, "Well, you just lost weight, and now you look better, and therefore you feel better as a result of that." But the fact is that there's insulin cycling changes and changes in hormones that actually occur that improve mental health in individuals who are obese and lose weight. So that's something else that we focus on. Now, the patient also has to be an active participant in their recovery process. They have to have a positive frame of mind. And it's important to have behavioral activation and restructuring of their lifestyle. It's critical for their healing. And the inner healing process is really the key. That's where it all comes from. You have to choose to get better. You can't just sit there and say, well, here I am, just make it happen. So some patients, though, will require other therapies to actually get better because ketamine might not work for them, and they may need dialectical behavioral therapy or EMDR for their PTSD or residential treatment and drug and alcohol treatments, TMS, or even electroconvulsive therapy. And these individuals, have a difficult go of it. Many of them are so depressed they just don't think as clearly and they miss their medications. They don't take them because they've lost their focus and their ability to schedule themselves. And of course, as the cognition gets worse, they basically lose the ability to have self-care, keep appointments, or other things. And so this is something which we see in a lot of patients. So then there's the treatment series. Once you've decided that ketamine therapy is a good option for you, and the physician who's evaluated you has agreed that it might help, the general ketamine process is as follows. For depression, it's 6 infusions generally. It's an IV drip. And we start a small pediatric 24 gauge, especially at Nova Health Recovery. We use the tiniest needles and we use a cold spray or topical numbing to really make it completely comfortable. And we use this IV drip. It's a 40-minute IV drip, and we do this 2 to 3 times per week. So you could be as many as 2 to 3 weeks to get the entire series done. And it's best not to let more than 5 days go between infusions. So you need to clear your schedule. You can't just do it once a week or once a month. And that's the initial series. So you've got to make time for this. Each infusion is 40 minutes in general, but it can be extended for some individuals. And of course, more time is not necessarily better, less time is not better. 40 minutes has just been generally the studied time, and sometimes we'll extend it because people get anxious. Now, the doses range from 0.5 milligrams per kilogram to 1 milligram per kilogram. That's based on ideal body weight. And sometimes more is less because higher doses basically do not necessarily work better. In fact, anesthetic dosing doesn't work for depression. So people who've done street K, a lot of times they're getting anesthetic dosing. They may go in the K-hole, but they're not going to get, less depressed. In fact, if anything, there is a difference between using ketamine when you're depressed and using ketamine when you're not depressed. If you're not depressed, ketamine is more like alcohol. You just basically get some strange feelings and dissociation, but the next day you actually feel like you're hungover. You actually feel worse. Whereas when you're depressed, there's actually neuroplasticity that results, and the individual actually feels better over time. And again, we need to use sub-anesthetic dosing and just recognize that you'll be awake most of the time, but slightly altered, especially in the initial doses. So at Nova Health, we start at the lowest dose effective and we escalate it as tolerated up to a certain amount. And you don't have to dissociate to have an effective result. And I have another study set and slide set that goes over dissociation and whether it's necessary for improvement in mood disorders. And the answer is, in short, no. You don't have to dissociate, so you don't have to be scared of ketamine. And likewise, the question comes up about addiction with ketamine therapies. Certainly, ketamine can be used in the wrong way, it can be abused and misused, but ketamine doesn't have any true withdrawal effect, like, for example, coffee or marijuana or food. If you don't take, marijuana or coffee after extended periods of use, you feel bad. Whereas ketamine, you don't really have cravings for it, but it can certainly be abused, and it is in Southeast Asia areas, for example, and in raves, usually in the context of other drugs. But it's extremely safe, it's extremely effective, and used medically and in a prescriptive manner. It's monitored, and it's extremely safe. So, abuse can certainly be caught, and it can certainly be monitored. As far as the treatment series, also, the results can show up at any time. And for some people, it's after their first infusion, they feel great. But others, it's around the fourth or fifth infusion, especially if you've been really dysfunctional for a long period of time. It may take number six and even a seven and eight in short succession to make ketamine work for you. Now expect a follow-up infusion 2 to 4 weeks after the series is over. And just to let you know that as far as work is concerned, most people are functional the day after the infusion. You just can't drive to or from the appointment. You need about 6 hours or so to really drive again, mainly because of coordination issues. The ketamine is out of your system. So if you're feeling great the next day, it's not because you're buzzed on ketamine. The ketamine was gone an hour after you left the office. It's just because of changes in the brain and the brain chemistry and neurocircuitry. So people work all day long and they come in to get their infusion, or they work the following day. Just also for information, sleep could be disrupted in some, especially women, as ketamine is activating for some. So the insomnia is kind of a critical thing, because insomnia and nightmares are basically a significant part of depression and PTSD experiences. And actually, it can increase the chances of worsening depression or even suicidality in some people. It's a big deal. And ketamine can cause some initial insomnia during the infusion process. That resolves after the end of the series. Of course, consideration for natural remedies to help with sleep, like melatonin and L-glycine, which is an amino acid, and valerian hops, passion flower, magnesium, and theanine can be very helpful. The use of Philips Hue bulbs with a red light in the evening can certainly be useful. And sometimes we use sleeping medications just to help people get to sleep during the infusion process, because it's very important for them to get that extra rest and during this period of time. And ketamine does increase slow wave sleep, which is very restorative and very helpful in the healing process. So what are the side effects of ketamine therapy? The main one is nausea, and that occurs in a small percentage of people. And it's during the infusion that it occurs, and it resolves shortly after. Traditional antiemetics are usually prophylactically given, and we usually use scopolamine patches to help people and prevent them from getting nauseated, or even antivert, mainly because people get nystagmus, which is like this bizarre shaking of the eyes. And that's part of the dissociative part of the ketamine. And that takes a few hours to go away, and it's just basically the cause of that dizziness and balance issues that you see for a few hours after a ketamine infusion. But if you do well in amusement rides, you generally do fantastic with ketamine infusions. Some people do get mild headaches, and that can be, treated with fluids, Gatorade, and Tylenol. The balance issues, which I already mentioned. And sometimes during the infusion, people will get anxiety because of the unusual feelings. This can be moderated by guiding the patient if they're uncomfortable, or having the family sit with them, or slowing or stopping the drip, decreasing the dose, or even using a benzodiazepine like Versed to relax the person. Now, we do follow heart rate and blood pressure, which do rise during the ketamine infusion. They go back to normal shortly thereafter. Now, ketamine works in a way that is different than any other medication currently available. It is a glutamatergic agent affecting the glutamine system, and it blocks a key receptor in the brain, the NMDA receptor in the cortex. And this causes a brief glutamate burst, which produces the release of brain-derived neurotrophic factor, BDNF, which then causes mTOR in the neurons of the brain to activate. This produces proteins, and it causes the formation of dendrites and new synapses in the brain. And basically, synaptogenesis and the formation of new connections is basically the definition of hope. It's the definition of happiness. It's the definition of antidepressant in the brain. And this is what ketamine does. And it's a complex methodology. We can discuss it in a future series. But neuroplasticity is the key to brain health. And This synaptogenesis repairs the damaged networks that have occurred from stress and increases those dendritic spines, which are those new early connections that allow the triggering of synaptogenesis. And of course, anytime there's glutamate and there's dendrite formation, there's learning. And learning improves cognition, it decreases fatigue, and it helps out with motivation. It helps our underlying neurotransmitter systems like serotonin and dopamine work better. Now, one other thing is that ketamine decreases the default mode network activity. And this is a little bit more nebulous, but the default mode is the parts of our brain that are deeper and allow us to daydream about the future and the past. And there tends to be more default mode activity when we're depressed. And it actually activates while we're busy doing things. That's the task focus network. And the two networks fight with each other such that you're having a hard time focusing and concentrating on what you're doing because your daydreaming mode has kind of fired off that self-referential autobiographical side of your network. And so you can see basically this co-activation of these systems makes it harder for us to get our job done. This is one of the issues with cognition that occurs in depression. And ketamine, by shutting this activity of the default mode network down, enhances cognitive performance. And also we know from other studies that ketamine decreases fatigue, and it increases wellness parameters like hope, self-esteem, energy, and just general wellness. So what do you bring to the office? Bring comfortable clothing, even spare clothing. You should bring that just in case you have any vomiting. Now, a weighted blanket's always awesome, but sometimes just your favorite blanket and eye shades and any comforting measures. In our office, if somebody has a assistant dog or animal that they use for their comfort, they're more than welcome to bring them. Also, noise canceling headsets and ambient music are a fantastic choice. And of course, bring a driver or a friend or family member who can stay with you during the infusion. Clear your agenda, get in your safe zone. Think of a particular problem you may want to confront, but don't expect any particular experience or answer. Again, once the infusion starts, your brain just kind of does its own thing. Don't eat for 4 hours before the infusion to minimize nausea, and no driving for several hours after. Try not to text or call people during the infusion. It's better to turn your phone, put it on the away mode. So these are examples of the infusion rooms at Nova Health, and they're generally designed with comfort in mind, more home-like. Some of the rooms have TV sets where we play basically just video clips of undersea or outdoor scenes. Other ones just have regular pictures with lazy boy type recliners and aromatherapy. But they're designed to make the set and setting perfect for the individual to kind of get in their zone. And of course, the lights are turned out and galaxy lights are used so the person has focal points. So when we start the sequence of the infusion, we check your vital signs when you come in, check your blood pressure and heart rate, establish that IV, using that small, tiny 24-gauge IV, give you your antiemetics, Zofran, Reglan, Compazine, Phenergan, Antivert, scopolamine patches, whatever it takes. Generally speaking, most people are perfectly comfortable even without those, but we give people usually Zofran just to kind of prevent things from happening. And then we put you in your electric comfortable recliner, zero gravity chair that we have. Turn on the galaxy lighting. Turn on our ambient music, or you can use yours with or without your headsets. And then we adjust Philip Hue lighting if you need it. Aromatherapy with whatever necessary scents that work for you, and essential oils, and bring in warm blankets for your comfort. And of course, you can have a bottle of water for drinking as well. The infusion starts. It's a 40-minute session. We monitor your vital signs, which generally don't change much. And again, ketamine is the safest drug on the planet. Literally, it's on the World Health Organization's essential medication list simply because of its safety and efficacy for anesthetic purposes. And we're giving doses significantly smaller than anesthesia. And so we don't interfere with people's journeys. We minimally interact with individuals. If they want us to do something, we certainly will take care of it. So at the start of the infusion, your experience would be one of generally numbness in your face and your arms. difficulty speaking and heaviness. You feel like your arms aren't your own, they just can't move anymore. And that's the dissociative part of ketamine. As the infusion goes on, you notice maybe enhanced color perception or auditory enhancement, or a sense of a lifting, a lightness in your chest and floating, even stretching. Everybody's experience is different. They may notice that objects seem to distort. Then they notice maybe time distortion, especially at higher doses. And of course, these experiences change depending on the dosing you use. The initial dosing is the lightest dose, that's therapeutic. And of course, it escalates each time. Now, synesthesia may occur at higher dosing. That's basically the ability to like taste middle C or feel the color red or hear the color green. And we do, in a lot of ways, think synesthetically. Like, for example, if you're driving down the road and you hear a song and it takes you back to the day when something special was happening or something not so special was happening. You could smell something or taste it in your mind as you listen to that song. And there it is. You've got synesthesia. You've got a number of senses intermingling and these cues and triggers that bring that about. So basically, ketamine allows a more vivid perception of this. And this is important because it allows our brain to basically communicate in areas that generally don't speak together so that we can kind of decrease that cognitive rigidity and consider new opportunities for learning. Now, one thing that you could consider the infusion journey is being like a carnival. You have a number of choices of rides you can go on. Do you want to do the merry-go-round? Do you want to do the roller coaster? You can kind of see the infusion experience as a series of choices is in your mind. And kind of a way I tell people is look at it like a lazy river of thoughts and memories and just let your mind go here and there and see what opens up. And if it's something anxiety-provoking or something you think you can learn about, then confront it. And if it's nothing you can learn more about, then you just seal it over and walk away from it and say, I'm done with it. And what really, again, like I said, is happening is a crosstalk in areas of the brain that generally don't connect. And just to let you know that also each infusion experience is going to be significantly different. Just because one was great today doesn't make it great the next time. And it's not really the fault of the infusers or the medication. Again, set and setting, but a lot of factors, some unknown to us, affect basically the way people feel. And whether you felt great about the end of the infusion or not, it just doesn't matter. You're still going to get the same effect. You don't have to float or dissociate to get efficacy. Sometimes less is more. Now, there is a lot of brain network crosstalking with psychedelics, ketamine in particular, too. And you can see in the graph on the left, where you can see networks connecting from a color field to a color field, and that would be a normal brain. But when given ketamine or psychedelics, you can see that there's crosstalk between different colors in the brain there, which represents basically different areas of the brain communicating together that generally aren't speaking together. So touch and sound and taste all get intermingled. And this is an important part of the healing process because it does help us, consider new opportunities for learning and stop the cognitive rigidity, which prevents us from having talk therapy sessions from working well. So how is improvement measured? Well, we pay attention to cognition in particular, because cognition is one of the first areas that gets damaged with mood disorders. We lose the ability to think, have executive functioning and planning and decision making. And that goes away early on in depression before the mood starts to change. So we check for these problems and improvements for attention, focus, visuospatial processing, working memory, using things like CNS vitals and the Cambridge Brain Science Test, which could be seen on our website at novahealthrecovery.com. And of course, we use online apps like Osmind to monitor, medically validated mental health questionnaires such as the QIDS PCL5, the HAM-D, and the PHQ-9, and other metrics to just follow and assess improvement. And of course, we look at functionality. That's always important in patient and family report. They're feeling better, they're doing better, they're more active, they're more social, they're less irritable, less agitated, and they're able to get back to work. That's the important thing. What is the aftercare? Well, when the series is completed, expect that you're going to have some booster infusions monthly. And at Nova Health Recovery, we offer home treatment with oral ketamine and nasal spray ketamine as microdosing. It's nothing like an infusion. It's just designed to maintain neuroplasticity. And ketamine is weight gain neutral. It doesn't cause you to gain weight or lose weight. And it's actually a treatment for anhedonia. It's one of the only treatments for patients who are emotionally blunted and have anhedonia. And so it's a relatively side effect treatment, a side effect free treatment that we offer that helps really kind of decrease the need for monthly boosters. And how long you do these treatments, really, if we get you to remission, then we can just kind of monitor you until things recur again. And of course, we want to refer you to the appropriate follow-ups, such as therapists and psychiatrists, and of course, alter underlying medications as appropriate. We need to address obesity and consider treatments that may be very helpful, like Victoza and semaglutide, which actually act as antidepressants. They're injectable GLP agonists that effectively decrease hunger and allow a person to increase their weight loss, but they also change insulin cycling and act as antidepressants. The other thing is addressing cognitive deficits with stimulants, sometimes that are necessary, like modafinil, Adderall, and Vyvanse. Because it's not really ADHD that the person has, it's actually that the attention circuits and certain neurocircuits involved with cognition just haven't come back online yet. And that takes time, even after ketamine. And of course, your lifestyle. You got to change your lifestyle. If you don't challenge yourself, you don't change yourself. You got to exercise. You got to walk. You got to move. You don't have to go running every day. Just walking is good. Getting out in the sun, letting that sunlight increase your vitamin D levels. And of course, supplements that are appropriate, dietary changes and weight loss, and avoiding, of course, alcohol and substance use. So if you have any further questions, you can certainly reach us. Email at novahealthrecovery.com. That's email with the @ novahealthrecovery.com. You can reach us also at 703-844-0184 if you have any questions. We do, of course, ketamine infusions for a number of different treatments, including prolonged infusions for pain situations such as CRPS. And we also offer home-based ketamine therapies with racemic ketamine and oral ketamine troches, ready to dissolve tablets. And of course, there's other therapies as well.